You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. If you are unhappy with your smile, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. My first guest is Dr. Andrew Skasko. Dr. Skasko, welcome to the program.
Thanks for having me, Randy. My pleasure.
Now, before we get into today's topic, tell me a little bit about your practice.
Well, my practice name is Elite Dental. It's really what I consider the culmination of a vision that I've had since I was in 7th grade.
7th grade, you said you wanted to be a dentist. You don't look like a dentist, by the way.
You know, everyone tells me that, and they always try and tell me who it is that they think I look like, and a lot of times I don't even know who that person is. But it's not ever anybody good.
Okay.
But it really was a vision of mine, and I really wanted to change people's perception of what dentistry is. So many people are afraid to go to the dentist, and today there's no reason to be afraid to go to the dentist. It is so different, and I really believe that my team and everyone at Elite Dental created an element and atmosphere that people actually enjoy coming to.
Now, I told you, I said, I feel like I could spot veneers 20, 30 feet away, and you said they probably weren't one of my patients.
Well, probably not. You know, we really care about what we do, and
so there's an art to it, making it look natural, because when I think of veneers, I think of big horse-looking teeth.
Yeah, and you know what? There are a lot of those walking around out there. I see them myself, and it almost becomes a disease, because you see someone and within seconds I'm diagnosing them and seeing how I can fix them. And you know, a lot of people come up to me and they ask me, what would you do? How can you do this? How can you fix me? And I love it. I'm just intrigued by what we can do. The technology in dentistry is unbelievable. But from an art and science standpoint, it's a blend.
So how much art, how much artistic talent?
You know, I was 70%? Making a joke with you earlier about us both being left-handed, and I said all great dentists are left-handed, which obviously I was joking with that. But I would say 50% is art and 50% science, because it's just like anything else. You need a foundation. So you need to learn the anatomy or the morphology of teeth, which are the shapes and how the teeth come into contact and how they function, and the physiology of the mouth and the musculature and everything that goes together to create a smile. Yes, someone could slap a veneer on a tooth and say, hey, that looks good. But if it falls off the next day because the occlusion or the functional anatomy of the teeth are not correct, then what's the point in even attempting to do it? And I'll tell you, it's unfortunate because I see it and I have to correct it. And
you correct a lot of cosmetic dentistry. People don't like their teeth after they have veneers. They end up in your lap.
You know, you'll see some cases.
Does that happen?
It does happen sometimes, and you know, everyone's human. As dentists, everyone's human, and I would never put anyone down for their work. You know, I do unfortunately see some things that could have been done differently, and I do them differently.
Okay.
It's in the eye of the beholder, and many people don't think. They don't really know what they want unless they spend time with someone like me to learn about it.
We're going to go through your process, by the way, because you say the patient plays a role here in what their teeth are going to look like.
They play a huge role. I mean, Randy, I know you've had a few things done which we've spoken about, and you
just on the sides, by the way.
Right, I know. But you had to know about it. You had to be involved. You had to think about if you actually wanted to do that. You had to see a diagnostic wax-up, which maybe you saw, I'm not sure, but
they did.
I would assume, because that's what we use to make the temporary stents, because it's really like a trial smile. Now, there are things out there called trial smiles, so no pun with that, but it really is. It's a blueprint. Just like you're building a home, you have a blueprint for your smile. And if the patients can't be involved in that, then they don't own the smile. I do. And I don't want to own the smiles. I want to create these smiles for them. Now, I have to spend a lot of time guiding these patients on what maybe my recommendations are for doing thousands of
what
veneers.
makes up a good smile.
Absolutely.
You have to kind of show them. I mean, you're a dentist, obviously. You have a bias. You think the smile is pretty important.
Of course, clearly, it's the most important thing.
I mean, do you believe that, really?
I really do, because who do you meet that you don't, now, okay, you've interviewed a lot of dentists, but even beyond that, who do you meet that you don't look at their teeth and their smiles? And what does it tell you about that person? A person can light up a room with a smile.
That is true. That is true.
There are people that I'm going to show you today that honestly, when they walk in rooms, they light the room up, and it's just because
But you don't want the teeth walking into the room.
Oh, absolutely.
You see that big
you do.
And by the way, I should say, you know, I try not to endorse the people on my program. Our show airs nationwide. I've seen a lot of dental cases. Excellent stuff. So I want to make sure people stay tuned for your work. But I mean, you say you're changing people's lives. How so?
Well, I mean, let's take, for example, a couple cases that I brought today. And again, I have a broad mixture of cases, some very conservatively, very conservative treatments, and others a lot more comprehensive and
veneers. We're talking about veneers today.
Well, it's a combination, Randy. You know, a lot of people say, oh, I just got veneers, or oh, I want veneers. And that's just something that happens because someone hasn't taken the time to explain the differences in cosmetic dentistry. Now, veneers are, yes, something that everyone knows to be cosmetic and the best of the best.
Okay.
But in certain cases, you have to blend a combination of restorations to get an ideal result. Some of these cases, which you'll see today, have implants intermixed with them, which I don't do the surgery, I do the rehabilitation, and so I'm kind of the ringleader of that. I do a lot of team-based dentistry, and that's what I'm real proud of that because I really think that that's why we're getting idealized results.
Okay.
But anyway, for instance, here's a great case. This is some pictures.
So this
of my
book,
office.
you show your patients this book?
Yeah, this actual book is sitting on my front desk. So
good-looking office.
Yeah, I really wanted to try and create a spa-like atmosphere, and we really did.
Doesn't look like a dentist office.
It really doesn't. And we've got a relaxation room where we do everything's personal. When the patients come into my office, they sit in a relaxation room. They get a 15-minute massage. One of my team members.
Is that right? Really?
Yeah, one of my team members comes in and gets their medical history personally, talks to them about their concerns, so that because so many people are apprehensive, as I spoke at the beginning of the program.
People don't like going to the dentist, right?
They don't like going there, and
still, even today, do you hear it where they say, you know, I usually hate dentists?
It doesn't happen in my office. I'm not trying to be biased about it, but quite honestly,
they like going there.
People read my reviews, and I met a woman the other day. She was a lovely woman, and she's going to need some work, and she let me know that, but I knew it as I told you about the sizing up in 2 minutes.
You couldn't help but notice.
And she said, you know, I'm petrified. I said, well, my office is definitely the place for you. You wait till you meet my team. Everything about the second that you walk into the office is going to relax you. And it did. It really did, Randy. And now we're going to get ready to start working on her, and she feels great. I said, but before you even come in, why don't you read some of my reviews? Read some things that actual patients have written about their experiences, and you're going to see that it's just a different type of world. And I really believe that I've accomplished my goal that I started to get there in 7th grade. So anyway, this is a picture of my office. Here's a great picture of my team here. Again, I couldn't do what I do without my team.
So are you responsible for those smiles? They look good?
I am. You know, my staff are my biggest fans, and we've done some wonderful things with their smiles. Let me show you some of the complex stuff or some of the things that we really have done to change some people's lives. First case I have here is Marcia. Marcia she's a close friend of mine. I've known Marcia for years, and she doesn't let people take pictures of her. She was so upset with me to even get that picture. You can tell.
So she didn't like her smile?
She hated her smile. But functionally, there were so many things that for me to really dissect what was going on with this smile, we'd be here all day. Okay. We really would, and I know we're pressed for time, so I really want to show you some cases. Marcia had a lot that was going on. This was a full mouth reconstruction. She was what we call class 3 malocclusion.
Is that an underbite?
It's just like this, where the lower jaw comes forward, okay? So, as you can kind of see in the picture.
So you can fix that. I mean,
Yes, and there are multiple different ways to go about fixing each of these cases. Surgery was an option for Marcia, which I presented. It was not an option. She wouldn't do it. She said, I'm too old to have my mouth wired shut. No, I don't care. I don't want it. So I really had to come up with some different options and think outside the box here.
So what did you do for her?
Marcia had a combination of therapy. She's got all ceramic bridges. She's got porcelain crowns, all ceramic crowns. She's got veneers. No implants in there, but so this was, again, as I spoke earlier, combination therapy.
You know, when you look at the before and after, number one, she looks happier. She looks more sophisticated. You know, teeth do make a difference, I guess.
They make a huge difference. Check this case out. I'm really proud of this case because this is an emotional case for me, honestly. It's one that I spoke of earlier where sometimes things don't get done right properly.
Pretty nice smile, though, she had.
You know, she did. Not really, actually. Her teeth are really discolored, and these were bridges. honestly. Those bridges were prepared when she was 16 years old, Randy. Right after orthodontics, the orthodontist, who's a close colleague and friend of mine who sent her to me, prepared her to have dental implants done. She was congenitally missing the laterals, 2 teeth next to your front teeth.
Okay.
Huge in your smile. Well, these teeth are what we call virgin teeth. They had never been touched. They didn't require crowns. They didn't have a problem. So what we did here with Brittany was obviously we had to go back in and we did implants. So you would never know it, Randy, but these teeth here, the lateral teeth, are dental implants. She's got some porcelain crowns and a combination with veneers. Had I done this case from the beginning, there would only be 2 implants here. There would be no crowns. Unfortunately, we had to do it this way, but the result was beautiful. And she is
look very natural.
As happy as you can imagine. Kieran is my English friend. You know, he's a designer at Abercrombie. He's around beautiful people all day long. He comes to me and says, honestly, Andrew, I don't like my teeth. I'm around these beautiful people all day long, and I have the ugliest smile in the room. Fix me.
Is that what he said?
He really said that, and I felt for him. These cases are, I take emotional responsibility to these cases because I know what I can provide, but they don't know. They don't know that I know. You know, I have to educate them on that. So we came up with a very natural result. Kieran has, again, he's got some crowns.
Very nice.
He's got veneers here. The smile line is perfect. We laugh at this picture, though. Excuse me. We laugh at this picture because Kieran had chapped lips that day, and my assistant Violet gave him some chapstick. So it looks like he's wearing lipstick in this picture. So we were cracking up, and we made a joke about it. Anyway, Kieran's off to Amsterdam now.
So did you say people, by the way, like compliment him on his smile? Do people react to him differently?
They complimented me. Of course they compliment him. Everywhere he goes, people notice. You know, the CEO of Abercrombie & Fitch came in and complimented Kieran on his teeth. People notice the smile. They just notice. People came in, patients that I see that knew Kieran, said, you did an amazing job with Kieran. You changed his life. You changed his face. Tim is another great friend of mine. Look at this case, Randy. Honestly, there are so many things going wrong here that we could fix. This guy wanted a perfect smile, bright white. He's got all kinds of wear facetting in here.
They seem flat, very flat.
Very flat. The shapes of these teeth, look how long they look.
Yeah.
It's so unproportionate for his smile. Flattened all over the place. This is what we call a diastema, so a space between the 2 front teeth. So he's always saying, my S's, they just don't sound right. I hate my smile. I hate my teeth.
They say this to you on a consult.
You know, as I said, I really get to know these patients well. That's why I keep calling so many of them friends, because quite honestly, we do become friends, because I learn so much. I'm probably the first to learn about major things that happen in a lot of these patients' lives.
Okay.
It's pretty amazing.
Okay.
But we did some unbelievable things.
So what did you do for this guy?
Tim actually was a veneer case. There are no crowns in there. These are all veneers, upper and lower veneers.
Huge difference in the before and after.
We did 20 veneers on Tim. Clearly, look at the side-by-side. The pictures show everything. They tell you everything. Tim owns a medical spa in Columbus, and he...
Now he looks like he owns something.
He deserves to own this now. It has lightened up his life. He actually smiles with teeth now. He would show no one his teeth. I walked in there the first time, and there were no pictures of him showing teeth. You should see them all now.
You say people learn to smile with their mouth closed.
They are. So many people are. And, you know, I love it, too, because people come into my office, and they're put together. I'll tell you, they come in with, my office is in an upscale neighborhood or area, and they're dressed to the nines. They've got their fancy cars. They've got their great watches. They've got all these great things going for them that they believe. And there's just something missing about them. There's something with their personality. It's just not fitting. And honestly, it's the teeth.
It's their teeth.
It is the teeth. And until I sit down and talk to them and educate them, and they know it's their teeth, a lot of people don't want to let others know. They want to hide it, so they don't want to show their smile. So they'll take a shot from the side, or they'll...
Is it their fear of the dentist that they don't do something about it?
You know,
oftentimes?
It is, and I think it's the fact that dentists, number one, they're going to the wrong dentist to begin with, and number two, other dentists are not taking the time to educate these people about how simple it is to fix these things today.
Okay, we're going to take a quick break. We come back, more before and afters. Also, I want to know about the process. What happens on day one and how you design the smile.
It's exciting.
Okay, good. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more dramatic before and afters, and more about what you need to know if you're considering any type of cosmetic dentistry. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of Breathorex. Only Breathorex has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription Breathorex from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with the dentist that everyone seems to be talking about because of the results he's getting with his patients. Today's topic, cosmetic dentistry, what's new and what can be done. So these, I mean, what do you call these? I mean, do you call them smile makeovers? I mean, do you have some kind of a term for this?
Some people say makeovers. The front of my book here says smile transformations, because I don't think it's just, we're not just transforming their teeth, we're transforming their personality.
You say they act differently.
Absolutely.
Just because of their smile.
Here's one very emotional to me. This is Alexis. She's actually my mom. You'd never know when you look at how young and beautiful she is.
All right, all right.
This is a full mouth, Randy. You can see some old porcelain fused to metal crown, so you can see that gray.
So the gray line is because, what, the lining is made of metal?
Yeah, there's a substructure that's metal, and there's porcelain blended onto the top of it.
I see a lot of that.
It's how we used to do things.
It's an easy fix, though.
It's a simple fix. Even if we just did some whitening and some... Now, she had a lot of other issues. She had some temporomandibular problems or joint problems, headaches all the time. Everything is corrected.
Was it hard for you to talk your mother into doing this?
Honestly, she is one of those patients that I spoke about. She was terrified of the dentist, even though the dentist was her son. Her appointment with me was hours. It took hours in the chair. She comes in all the time now. Well, I don't even have to see her that frequently anymore because all of her teeth are perfect. But she was so paranoid and so terrified of the dentist because of past things, and she's done wonderful now.
Now, when they see themselves for the first time with these new teeth,
they're crying.
Really?
I see tears every day in my office, and my staff is crying. I'm crying. It's just, you know, we have tissues in every
It sounds like an exaggeration sitting here, but people...
It's happening, Randy. It's happening daily, and I'm so passionate about it. I love to meet new people and tell them what we can do. It's unbelievable. Joe actually followed me from an old practice that I used to work in. He was an old college athlete, and you can see, as he was playing basketball, constant grinding of the teeth. This is called bruxism or functional bruxism because of the way he's doing it while he's playing a sport, concentrating and bruxing and grinding. We did 18 veneers here. It's an unbelievable result. He's the happiest guy, and you know, I don't know what else to say about Joe.
It's a clean look.
It's clean, it's natural, it's masculine, you know. These smiles are designed for the patient, for their lips, for their facial characteristics. It's so exciting what we can do.
So how, I mean, you say you customize the smile for the person. I mean, how much, be specific. I mean, how so?
Look at Joe's teeth, for instance. The maxillary or upper teeth follow the lower lip line perfectly.
All right.
It's showing the ideal amount of reveal for his smile. We look at his facial proportions and decide, based on some of his other size and shapes of his teeth, what size incisors, laterals, canines fit his mouth. So we plug that in. We do this diagnostically before. We decide where we want to bring his buccal corridor. Here it was shrunken. We wanted to widen his buccal corridor.
What's a buccal corridor?
Buccal corridor is this area here, and I'll tell you.
The outsides of the mouth.
The outsides of the mouth.
Because he's showing a lot of teeth, this guy.
Absolutely, because he's got a nice broad smile now. So many people only do a few teeth in the front, or people come in and they say, I want 6 veneers. I say, well, do you go to the office with a shirt on and no pants? Because quite honestly, sometimes that's what it is. People are not finishing their smiles, and the buccal
all the way
corridor
across.
is and you know, if
so is that what defines a good smile? I mean, when you think of people like Julia Roberts, big smile.
Julia Roberts is probably one of the most recognized smiles there is because of the broadness and the beauty of her smile.
So that's what you're doing with all these smiles.
You know, that's what we try and achieve,
okay.
And it just comes down to, if I can be more conservative and not do that, we do. Okay. It just depends on what we want.
We have time for a few more.
Okay, let me just show you a few more. These are excellent. Here's a conservative case. He hated his front teeth. He had bonding, old composite restorations on his front 4 teeth. All I did was 4 veneers here. Whitening and 4 veneers. He was done.
Very nice.
That's all. I got a few more here. I really want to show you a few of these, Randy. Let me show you a few more. This is my optometrist, Dr. Smiley. He's a wonderful guy. Look at the difference.
Did you say Dr. Smiley?
Yeah. How funny is that?
His name is Dr. Smiley.
Yeah, and he's an optometrist. He should be a dentist. Should be a dentist. He said, you know what, Andrew, I'd rather leave it to you because I know you're the one that's going to give me the smile that I want. And I did. We're not done with him yet either. We've done his top. We're going to do his bottoms. Look at the functional problems with his bite. He doesn't even reveal his lower incisors. Okay?
So you fixed that?
I did. And this was a combination case.
But if you don't fix it, what happens?
Over time,
they'll chip off?
Well, first of all, look what happens. Look at his bite here. Look at how close there's something that's called the vertical dimension of occlusion, okay? And that's the width or your face height. We take face heights in thirds. Top third, middle third, bottom third. Look at how deficient his bottom third is right now.
Interesting.
And this was a combination therapy. We did some orthodontics with this patient to intrude and extrude teeth, okay, to bring them to different relationships before I put restorations on. It's just, again, what I talk about. If you don't get the substructure and foundation right, I'll put veneers on. Where am I going to put veneers? How am I going to make these lower teeth
So before
long?
and after.
It's just unbelievable. I mean, natural smile. Chris and I picked him out together. He knew what he wanted. He was so involved in his treatment. It's an unbelievable case. It's an unbelievable case. Randy, do I have time for a few more? I really want to show you some of these cases. They're unbelievable. This is one I'm in the process of working on right now. Rick, again, another combination orthodontic case. Look at where his bite was. This is where his bite was. Look at how low that tooth was. Again, that's...
So they're perfectly flat in the before.
And that's bruxism. That's parafunctional bruxism. He's grinding these teeth down completely.
So you fix the bite so it won't happen again?
It will not happen again. Now we can actually restore his smile. He didn't show his teeth at all. Look at this smile. It's just unbelievable.
Looks like $1 million.
It really does. And I can't wait to do his lowers. We're doing them next month, and I can't wait to do it.
There's another woman. All veneers. These are veneers?
These are actually porcelain crowns, all ceramic crowns here. It depends on the length that we have to add in porcelain, what type of restoration I do. So it's very specific.
What's the difference between a veneer and a porcelain crown?
A porcelain crown covers the entirety of the tooth, so it's what many people would call caps.
Okay.
A veneer covers the front or facial part and the edge and a little bit behind, so it's kind of got wings around them.
I see.
So veneers are more conservative. If we can do veneers, we do them. Obviously, that's my first choice. In cases where I need to lengthen the teeth beyond what my normal comfort zone with porcelain on a veneer would be, then we elect to go with ceramic crowns, which you can see the results are just unbelievable. Here's the last one I want to show you here, Randy. Conservative treatment, she hated her smile. She hated her smile. And look at the difference. She's got 8 laminate veneers. These are all veneers.
Very nice.
And that's it. She's got a new, bright smile. They're just lighting up now.
And we're out of time, but the process, if somebody goes in, okay, how much say-so do they have? And what's that process like?
Honestly, I believe
on how their teeth are going to look.
It's a blend. It's 50% me, 50% them. I want them to be involved.
So they tell you what they want.
Well, I have to educate them about my recommendations based on those proportions and things like that we spoke about earlier. If they're in the dark if I don't educate them and tell them my recommendations. But then, once we show them the sizes and shapes and all these things, we look through catalogs. Absolutely. We look through catalogs. We look through before and afters. We choose shapes. There are masculine smiles. There are feminine smiles. I really like to simplify it, though. You come into my office.
Yeah.
You come in for a consult. You come into my office, you want veneers, you want work, you know you want something done, you need work. we like to simplify it. Consultation and diagnostics. If you really know that that's what you want, we can start that day on your diagnostics, which would be radiographs or x-rays.
Do they always meet with you on this?
Absolutely.
All right.
That's another thing. You know, my practice is what I consider boutique. The patients know me. They spend time with me. This is not a factory.
Okay.
It's just not.
Okay.
So
I laugh only because I appreciate your passion here. I mean, you like doing this.
Again, I said earlier,
you're very proud of your work. Good for you.
There was nothing that I could choose in my day-to-day life that I would rather do than this. And you'll see, after I'd ask you to take a look at just a little note that I wrote to some of these patients at the end, and it just kind of talks about what my relationship with them. But consultation diagnostics, smile design and wax up, and these are so that we're at first appointment. Second appointment is smile design and wax up.
Did you make a model of their teeth?
Absolutely. We make a model, and it's a blueprint, as I mentioned, so that they can see what we may want to accomplish. Sometimes I'll look at the wax. This isn't right for you. With your facial characteristics, I want to change this. Oh yeah, I think that I agree with that. Or no, doc, I kind of like this.
Okay, so they like what they see. Then what?
We go to preparation appointment. We schedule.
So they get temporary teeth while their veneers are being done.
Absolutely, and then the final stage would be the seating.
So it's still not over. They get their temporaries.
And the temporaries are fabricated from the wax up, which I personally, after I send it to my lab with all my instructions of what we want to achieve with this case, I make the temporary molds so that when I place these in the mouth, these molds are exact to what they're exact replicas of this wax up. It's a trial. It's a trial.
Okay.
And in the first couple days after the case, I call them personally, and I call all my patients personally. I'm sure. I mean, every patient I work on every evening gets a call from me. It's just how I work. I really want to know how they're doing. So I'll talk to them about day 3 after preparation, and I'll say, how do you like things? Is there things we can change? And usually it's no, because we spend so much time beforehand perfecting these smiles.
They're happy. Well, thank you for coming on the show.
Thanks, Randy. It's really
final
been fun.
message. Somebody watching this, they don't like their smile. What do they do? First step.
Stop waiting. Honestly,
do something about it.
Cosmetic dentistry is here to stay. People's smiles are elements of their personalities. If you don't change your smile and you're unhappy, you're always going to be unhappy.
Okay.
The smile's the most important thing.
Great stuff. I want to thank you for coming on the show.
Thanks, Randy. It's my
very
pleasure.
Good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.